put into this model, which is based on an Excel spreadsheet, is the number of trips that are either monitored on a particular road, in a city, on a country, or projected to be the result of a certain intervention, and the average length of those trips. And then the rest is calculated automatically by this tool, which is based on best available evidence, and we've had the pleasure of working with about 25 experts from different fields in different regions of the world, and received quite good feedback on that. So if that's something of interest, to speak with your policymaker because you think they should invest in cycling and walking, and this might be something that you can use. And if you apply it, please let us know and send us the result of your application, because we want to make the case studies and examples available. And if you have any feedback, we are very open and interested to have it. You can download it on our website. We're currently starting the development of a similar tool for walking and hope to have it available maybe in a year from now. We're still waiting for the donor to make the final commitment. Another program, which of course many of you probably are already aware of, the Healthy Cities and Urban Governments program, launched 20 years ago actually. They have their anniversary this year. It's now including about 80 cities in 28 countries, altogether 1,200 cities and towns across the world. Its main aim is to involve local governments into health development in a very comprehensive way, including health considerations into economic regeneration and urban development and planning. And in the 2003 to 2008 phase of the program, healthy urban planning and physical activity and active living are actually one of the core themes, and we're working on different projects in this area of physical activity on the local level. Another relevant activity that I wanted to bring to your attention is HEPA Europe, the European Network for Health Enhancing Physical Activity. And if I may add to what Jakob Kornbeck has said before, actually our Finnish colleagues have developed the HEPA concept, not WHO Europe. And I've just said to Jorma before that without the Finnish, who are really the fathers of this concept, HEPA Europe wouldn't exist probably today. And we're very glad to have very active involvement of our Finnish colleagues in this. It brings together different institutions and organizations from all over Europe. We've currently over 50 confirmed members, and if I count in all the new applications, we have about 80 from about 25 countries across Europe. It's institutional memberships. We have 2 honorary individual members, but all others are institutions, including ministries, academia, NGOs, from across the board. So our current chairman represents the sports sector, we have public health sector, we have environment sector, we have transport sector institutions. It collaborates closely with WHO Europe. As you can see, we've been invited and accepted a facilitating and coordinating role, which is played by me. A key focus is on facilitating these multi-sectoral approaches, as I've mentioned before. It is meant to advocate physical activity and to support the exchange of information, to promote and disseminate innovative HEPA strategies, programs, approaches, and good practice, and to also promote and engage into research. And you have the leaflet here and can find more information, including on applying for membership. If any of you are interested in that, it's all on our website. A few selected activities. HEPA Europe has been instrumental in developing that inventory that I've just presented before. We have another activity was to collect case studies of collaboration between transport and physical activity promotion. We brought together some 50 case studies, practical examples. Also conceptual work is done, for example, developing a methodological framework for physical activity promotion. And I've already mentioned the guidance on economic valuation that we're investing in. There are a number of working groups that work on specific topics. One on physical activity and sport promotion in children and adolescents, which is led by our colleagues in Switzerland, the Federal Office of Sports. There's a working group on national approaches and networks for physical activity promotion, and our colleague Anita here is organizing a workshop on national strategies in the framework of that work group later this year, and the handout is also back there, where we want to exchange experiences on challenges and solutions that occur in implementing those national strategies across Europe. Another work group looks at primary care approaches to physical activity promotion. We have annual meetings, the next one taking place in September 2008, and please mark it in your agenda because the call for abstracts and symposia is still open until 5th of June, so still a few days to go. Please go to the website if you're interested to come and submit abstracts or symposia, and join us in Glasgow. Wolfgang Baumann also invited me to try to think about potential areas for collaboration, and this is a very non-exhaustive first list of potential ideas that I had when I thought about this, and I know that we're going to talk about this more over the next 2 days. Of course, we welcome warmly any support to the WHO advocacy activities that are ongoing, and I see a lot of potential synergies there. We're also interested to collect data and information to make it available, for example, through the inventory. So if you know of documents or activities or data that is collected, then let me know that we include it into the inventory and make it available. Case studies are of utmost importance, especially if they're well evaluated. We have an ongoing collection of making these case studies available and tools to describe them. We could think in various ways of developing and helping an application of WHO tools and guidance, but also work together in the development of guidance as with ESFAN and HEPA Europe currently for these new guidelines for sport for all in sports clubs. So there are many opportunities, I'm sure, in this field. Supporting selected activities and projects with national and local partners. I guess the only limit we have is the sky, certainly not our imagination. So you can find more information here, and I thank you very much for your attention.
A few minutes for some questions to Sonja. Please.
In Rome, since the middle of 70s, we have so much campaigns to encourage people to be active, to stimulate people to be active. In the western part of Europe, especially, I'm talking about Germany, Finland, the Scandinavian countries, the Netherlands. Until today, we have tried to make new programs. And the conclusion at this moment is the same situation as we had in the middle of the 70s. And I know the society has changed. But what is really going wrong? Where we have made mistakes?
This is, of course, the question of all questions.
That's why I'm here.
Indeed, no, a very important and good and interesting question. Thanks a lot. I'm by no means able to give a definite answer, but I will share some thoughts I have on that, and of course everybody else can join me in. First of all, maybe I'm not as skeptical as you are. And if you mentioned the Nordic countries, Finland, for example, is a country that has, first of all, data since 1975, I think. And therefore is able to show that actually they're one of the few champions, probably together with Canada and not that many others, where physical activity levels have gone up. And this is the result of a long-term investment, political will, and accordingly the right investments, important investments, so they have not taken this lightly. They have done a lot right, and we have a lot to learn from them. So I think we also have examples of what can work and what is needed. But it is not easy, the task we have at hand. So it's not something that we can achieve in a year or two. So we need a long breath, I think, and we need the help of policymakers and to ensure that the political will is there beyond the next election period. That is certainly facilitated by developing the right policy frameworks to make sure that this goes beyond individuals that can carry this forward. But that something is written, endorsed by governments at best, to ensure that this is a long-term investment and not a one short of program that is abolished after 2 or 4 years. We just have to face the reality that this will take a long-term investment. But we have so much to gain and so much to lose that I don't think it's really a question. You said also the society changed. It did change dramatically since the 70s. And environments have become so much less supportive for physical activity. Unhealthy food is so much more easily available to children, to all of us, actually. So the challenges are becoming bigger, so it's getting harder, unfortunately, not easier for us. What else could I say? I guess those maybe a few points. I hope anybody join me, please.
Thank you very much. I think we have to hurry a little bit because it's quite late now. So we ask about the